Hello, everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us for another webinar. Today's webinar is Preventing and Resolving Data Matching Issues. I'm Aisat Odiale. The Health Projects Assistant at the Center on Budget and Policy Priorities, and I'll be moderating today's webinar. Beyond the Basics is a project of the Center on Budget. It's designated to provide training and resources to facilitate enrollment in the ACA health insurance marketplaces and Medicaid. The Center on Budget is a nonprofit policy organization. We are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This session is not intended for press purposes, and we are not able to offer continuing education credit for our webinars at this time. Webinar logistics. So automated captions have been enabled for this webinar, and to view them, you can click on the More option or the double CC icon at the bottom of your screen. There you should have the option to turn on closed captioning. All participants are muted and in listen-only mode. But if you would like to ask a question, you definitely can. You can click on the Q&A icon at the bottom of your webinar screen and type your question into the box. We will be monitoring questions and will pause for Q&A during the presentation. We may not be able to answer every question asked, but we will do our best to get back to you after the webinar, and we'll have a record of all of your questions, which we'll use as a guide for future resources and presentations. And of course, you can email your questions during and after the webinar to beyondthebasics@cbpp.org. A quick reminder that you will not be able to click on your screen to go to any of the links shared in the deck, but I will place a link to the deck in the chat where you can find all of the active links. And after today's webinar, we will send an email recording of this presentation, along with links to the slides and of course other resources. And we will post everything to the Beyond the Basics website. So here you can see the webinar schedule. We are hosting a combination of traditional webinars and new office hour sessions. For some topics, not a lot has changed since last year, so we're offering office hours to give you a quick refresher and answer your questions. But you can always refer to our webinar archive for in-depth webinars on these topics, and this includes households and income, the premium tax credit, plan design and plan comparison, and the annual re-enrollment process for the marketplace. And we're offering full-length webinars on topics where there is new information to share or where we typically get a lot of questions, including eligibility, outreach, and application issues for people who are immigrants, and resolving data matching issues like the one we're hosting today. We're also introducing 2 new webinars, What's New for 2025, both being delivered next week in English and Spanish. Finally, for the first time, we'll be hosting an enrollment trivia challenge to round out the series, a quiz show for both new and seasoned assisters to put your eligibility and enrollment skills to the test. Today's webinar will cover overview of data matching issues, DMIs, verification of citizenship and immigration status, verification of household income, verification of other minimum essential coverage, general tips to prevent and resolve DMIs, and identity proofing for healthcare.gov. Today's presenters are Shelby Gonzales, Vice President for Immigration Policy at CBPP, and Jenny Sullivan, Director of Health Coverage Access at CBPP. Now I will turn it over to Shelby to get us started.
Thank you so much. I'm really excited to be here today to talk about one of my favorite topics, data matching issues in the marketplace. Next slide, please. So as you know, when people go through the application process to get enrolled in marketplace coverage, there's a lot of information that they're providing about their own circumstances and circumstances of other individuals within their household. And individuals that provide this information are going to they're supposed to be making this attestations truthfully. They are told that, you know, they must provide truthful factual information, and that there's a penalty of perjury for providing you know, inappropriate, you know, not accurate information. So people generally are going to provide correct and accurate information. And a whole lot of information that people provide in the application, people are taken at their word for it, unless there's a reason to that, you know, things are not adding up, right? So, for example, there's not a requirement for individuals, even though there is a requirement for people to live within the service area of a marketplace, which is in all states, a state, that is not necessarily something that has to be required to be verified. There's no evidence that needs to be provided. So the verification with the attestation plus the fact that people are attesting to providing truthful information is sufficient to verify that information that's provided in the application. But there are other factors that the law requires that marketplaces actually provide some kind of documentation um, out other than you know, to provide additional information, or either in some cases, in the case of citizenship and immigration status, it's very specific what has to be provided in terms of being able to make sure that sufficient documentation is provided to ensure that an individual is eligible for coverage. And now the good news is that for a lot of these factors, like a social security number, like immigration status, US citizenship, and access to, you know, already enrolled in other coverage like Medicaid, and in some cases, some income sources such as you know, taxes and the work number and other things. The When an individual is going through the application, they provide some information about their circumstances, like their name and social security number and other information, and the government is able to use those factors to match against data that's held by different trusted sources, all of the ones that are listed right here that you see, a graphic element that talks about those sources. And if the attestation, the information that's provided by the individual, is able to be substantiated by this data match, then that's good news. That means that the individual does not have to provide additional documentation or information to get past this requirement of documenting circumstances in the application. So that's good news when this happens. But data matching is not perfect. Next slide, please. Oftentimes, some individuals will run into bumps in the road during data matching. And it's really important to note um, that when these bumps in the road happen, well, one, we call them data matching issues, and it's basically means that information that was provided in the application about this person doesn't sufficiently match up to what we have available to us in the resources that we're able to, as the government, not me, because I'm not in the government, but that healthcare.gov and state-based marketplaces have, that it just isn't sufficient to be able to substantiate the claim, and that additional information is needed. It does not mean that the individual has told incomplete or incorrect information. It just means that we live in an imperfect world and data matching is not perfect. There's a variety of reasons that people may get a data matching issue occur where the data just simply is not going to be there. Maybe an individual had not filed taxes in the previous year or years. Well, then the IRS data has no way to be able to substantiate the income. Maybe individuals their income has changed vastly from the last time they file their taxes. Well, that happens quite a bit, right? Some individuals may have changed their status. So, for example, they were previously an immigrant and now they're a U.S. citizen. Well, the way that we do data matching to prove citizenship may result in an error. It's saying we can't substantiate it because we don't, the data resource just doesn't have all that information. So there's just a variety of different reasons why data just isn't going to be sufficient. There are other reasons why the individual's attestation may not be able to be verified just because it doesn't match quite well enough. So it's not reasonably compatible based off of thresholds that the marketplace uses. So that might happen, for example, if the household size changes, maybe um, there's a new individual within that household, which means now the household is larger than it was the last time somebody filed taxes, so there's a mismatch. Or perhaps somebody changed their job or got a significant raise. All sorts of reasons could result in a data matching issue. So what happens when this data matching is not successful? Next slide, please. So when this doesn't work out, the good news is that the individual will be told, they will be told several different ways. They will get something that's told on screen. They will get an eligibility determination notice that explains that the applicant needs to provide more information to verify one or more attestations or pieces of information that they provided on the application. And in general, people can temporarily enroll in the marketplace plan based off of the attestation they provided. And in most cases, they can actually receive an advanced premium tax credit and their cost sharing reductions while they resolve the data matching issue. And consumers generally will have 90 to 95 days, 90 if it's an income based inconsistency data matching issue, in 95 days if the factor is around citizenship and immigration status. Next slide, please. So as I mentioned beforehand, the individual is going to be told in multiple ways. Some examples of some of the language that people will get as they're either on screen or, in their notices. They will also be provided some, next steps, here's what you should do. And some time frames are also included, so that individuals know what is the information that is needed to be able to complete to resolve the data matching issue favorably. Next slide, please. And in addition to these notices that people get on screen and in their eligibility determination notice, people will also get warning notices 90 days out from when they have to provide or resolve the data matching issue, 60 days, 30 days, 15 days. And they will get phone calls too. They'll get outbound calls in an attempt to try to resolve the issue before an individual is determined that they have not successfully resolved the data matching issue. Now, it's great that outbound calls get made. A lot can get resolved with a telephone call. However, you and I probably are similar, I would guess, because I think anytime I ask anybody this, they say, yeah, that's how I do too. But there's a phone number that comes on my telephone that I'm not familiar with, I probably am not answering that phone call. So that's a barrier, and just important to note when you're working with somebody and they have a data matching issue, giving them a heads up that 15 days out, a couple weeks out from it resolving, they may get a phone call that they may want to answer it. Um, if the data matching issue is not resolved, then the individual will get a notice that indicates that their data matching issue has expired. And when documents are submitted, if they're sufficient to resolve the data matching issue, the marketplace will send them a notice saying, good, everything's, that has been resolved. If it's insufficient, the marketplace sends notices saying that this isn't enough, like, we got your documents, but this isn't gonna do it, and they'll be asked for additional information. Next slide, please. So I'm gonna go through and talk about what this looks like for verification of citizenship and immigration status. Next slide, please. So if I'm in the application and I'm applying for myself, early on in the application, I'm going to be asked to provide my social security number. And assuming that, because one of the first things that's going to happen with that social security number is that the application is going to go to, it's going to share information with Social Security Administration to confirm that this is a match, right? That this is a usable social security number based off of the name and information, other factors about the individual that they're working with. Okay. That happens pretty early on once the SSN is provided for an individual that's applying for coverage in the marketplace. Next thing that is relevant, in terms of questions around citizenship is that the individual that's applying for coverage is going to be asked to attest to being a US citizen. So as you see on the right-hand side of the slide, is Jane a US citizen or national? Yes or no? And in this case, I'm going to say that Jane says yes. So then healthcare.gov is basically going to take the information that now Jane has said that she is a US citizen. She's going to use that social security number that was um, put into the application earlier, take other factors about Jane that have already been provided in the application. We'll shoot that information out to the Social Security Administration. And if the Social Security number, the Social Security Administration can verify that this is a match, all is good. Jane can move forward. If the Social Security Administration can't substantiate citizenship, then Jane's going to be asked if they are a naturalized or derived citizen. And if so, Jane will be asked to provide information related to either the naturalization certificate or certificate of citizenship. And then that information, if it's provided, which is a big if, right? Not everybody walks around with their naturalization certificate or certificate of citizenship, but assuming that the individual does provide that number, then healthcare.gov uses it to match against information that's in the systematic alien verification for entitlements program that we often refer to as the SAVE program. It's a database that's maintained by the Department of Homeland Security, and they will try to verify the immigration, the citizenship status instead of Social Security Administration. Next slide, please. For individuals, I'll pause for 1 second before I go into what documents are used to prove citizenship when there's a data matching issue. I should just note that in the previous slide, the two data matching, steps, one first with Social Security Security Administration, just, if there's a data matching issue, it doesn't mean that this individual for sure is not, it's not telling you the truth or telling you the application. It actually just means that the Social Security Administration just doesn't have enough information to be able to make to be able to substantiate the claim of citizenship. That's all it means. And there's a lot of people that will fall into that circumstance, especially people who, have gotten their citizenship through the naturalization process, or that they were derived. And derived pretty much means that one of or both of their parents was a U.S. citizen, and the individual got their U.S. citizenship based off of the fact that one or both of their parents were citizen, not because they were born within the U.S. So oftentimes it's people who were born abroad. Another step would have had to been taken, and oftentimes is not, because this, Social Security Administration is not in the business of like having to verify people when they change, from one eligible status to another eligible status. And once somebody becomes a lawful permanent resident, that there's no reason for somebody to have to come back in and also say, oh, by the way, now I became a citizen. So, from the Social Security Administration's point of view, they have what they need, when they become a lawful permanent resident. And then on the other hand, for the save match, again, there's a lot of reasons why there could be a mismatch, and one of them is simply because people didn't have access to the numbers that of those documents when they were completing the application. Unfortunately, that happens quite a bit, and this is going to be my commercial to you all, to do everything you can when you're in the application process and when you're working with somebody, to submit as much information as you can. So to the extent that that an individual, can say, maybe you're on the phone with them or whatever, or maybe they're going to come and meet with you in your office, next week. You might suggest, like, hey, here's some common things that are asked that it would be helpful for you to have, if um, when you come. Just because the more information you can provide in the application, the better. Okay, so if an individual, they were not able to get their status verified, through this data matching process, then for citizenship purposes, they would have to submit one of these documents here. And if they have one of these documents, they are preferred because it's only one document that proves both citizenship and identity. Whereas if they have to use some other document, which I'm going to share with you in the next slide, they usually have to provide either two pieces of documentation, some cases three. So one is better. So to the extent that somebody has a US passport, a certificate of citizenship or of naturalization, state issued enhanced driver's license, um, those are great. And other documents here. Um, Next slide, please. But if not everybody does, right? It's expensive to get a passport. People lose, their certificates of naturalization, other things. So in the case that you're working with somebody who doesn't have those, then they would need to submit one piece of documentation that's listed here on the left side of this table. Things like that start with U.S. public birth certificate, right? A consular's report of birth abroad, those kinds of things, something that proves birth. And then they would need to add something that proves identity for the individual that's applying for benefits. But that's where you see things like driver's license or school identification card or clinic doctor, record, all sorts of things here on the right-hand side. So again, it's generally better if an individual has one on the first slide, but if not, you need two pieces of evidence to prove citizenship. Next slide, please. If an individual says no to the question about citizenship, then they'll get this other question instead. So here, Jane's going to be asked, do you have an eligible immigration status? And if you see the lettering that's in blue, that if you click on that link, it's going to give you the full list of eligible statuses for marketplace coverage. So we're going to say that Jane took a look at that and she said, yes, I have an eligible immigration status. When Jane says that she has an eligible immigration status. She'll be provided the opportunity to select the document type that corresponds with Jane's most current documentation and the immigration status. She will select one of these documents that she has, and then she will provide the relevant numbers from that document. And that information will be taken by the by healthcare.gov, and it will be shared with with the Department of Homeland Security SAVE system. And next slide, please. And we'll try to verify the status. Right here in this slide and in the next slide, we basically show what numbers are going to be requested from these documents. So the USCIS registration number, the card number for individuals who have a permanent resident card, that kind of thing. So I'm not going to read all of these to you. That would be very, very boring, but very helpful to have these kind of accessible to you at your fingertips as you're helping people enroll. Next slide, please. So, okay.
Shelby, I don't think we can hear you. You might have to mute, then unmute. Yeah, we're still having difficulty hearing you.
Can you hear me now?
Yes, we can.
Okay, how long did that take that you guys lost my
I think we're on this slide 18.
Okay, so you're okay. My apologies. There's been something strange happening with my microphone where it just goes off sometimes. I don't know why. Okay, so there's some examples of so you saw in the first the two prior slides, it's basically just a listing of all the different kinds of statuses an individual might have, and then the corresponding kind of I'm sorry, the corresponding document type somebody has based off of their status, and then what are the numbers that they will be asked to provide in the application. This isn't something you have to memorize, but it's just very helpful to have that, those charts. And then we also provide a reference guide that's available through the link in this slide, which I think the slides are going to be shared with you later. And again, that's just helpful to have at your fingertips because it's going to be confusing. There's been lots of iterations of different document types. So for example, nowadays when somebody is a lawful permanent resident, they'll be asked, their USCIS number is labeled as such. That used to be called, it's not great language. I'm glad that they don't use it anymore, but it used to be called an alien number. So that's there's lots of changes. And sometimes the numbers that you're asked to provide, it's just not labeled super clearly. So you'll see that an individual has to provide a card number, but they might not really be clear in terms of the labeling as to which number. Like if you see the bottom graphic, there's a lot of numbers on this card, and you might not realize that it's, in this case, is the CRC number, that you would have to provide. So it's not necessarily intuitive. And that's the reason why healthcare.gov has some examples on its website. So that's good. And we also have a reference guide as well that you're welcome to use. Next slide, please. So if a DMI related to status is not resolved, the applicant will. So first of all, if an individual is not able to have the data matching work to be able to verify the person's status while they're in the application, then they will be able to still enroll in coverage during a 95-day window. And if they're not able to resolve the data matching issue after that 95 days is complete, there's an expiration because there's no success, the individual will actually stop having coverage. So unlike what you're going to hear about in terms of income data matching issues, when you are not able to successfully verify citizenship or immigration status, the person loses coverage altogether. It's not just about losing PTC eligibility, they lose coverage. If they later submit documents after there has been an expired data matching issue, um, they will, if they have had their coverage terminated and then they resolve the DMI, they will be eligible for a special enrollment period to re-enroll in coverage. And the SCP can begin the day their DMI is resolved. And they'll have 60 days from that date to re-enroll in coverage as well. So you can either have, you can have the coverage either begin retroactively to the date of termination, if the individual would then, of course, have to pay for those, any kind of monthly premium, their share that they didn't pay, or they could do it prospectively based off of the plan selection dates that normally are utilized. Next slide, please. So let's go through an example. So in this example, we have Laura, who lives with her mother, Julieta, and her daughter, Martina, and they are all applying for healthcare coverage on healthcare.gov. Laura completes she completed the naturalization process to become a U.S. citizen. Julieta has been in the U.S. for 8 months and is applying for asylum. She recently obtained authorization to work, and Martina was born in North Carolina and has U.S. citizenship. Next slide, please. On the application, all the family members provide their social security numbers. Laura and Martina attest to being U.S. citizens. Laura is asked if she's a naturalized or derived citizen. She says yes. Laura does not have the certificate of naturalization, so she skips the question asking for document numbers. No additional information is asked for Martina after her citizenship attestation, which is oftentimes the case, by the way, for children born in the U.S. It's usually, of course, there's exceptions, but oftentimes it works to have their status verified. Julieta attests to having an eligible immigration status. She provides her U.S. CIS number only. Next slide, please. And we're going to say that we saw that we had a match for Martina. We didn't get a successful data match for Laura or Julieta. Next slide, please. Okay, so eligibility results. Laura and Julieta are instructed to provide documents to prove their status within 95 days. All family members are approved to buy Marketplace plan and are awarded advanced premium tax credits in the meantime, right? So again, Julieta and Laura, even though they have Julieta, oh, we have the wrong, Julieta should be with the mom's picture, and Martina is the child. But in any event, you get the idea that that they're still able to get coverage, and they still have to take some steps to provide documentation of their status. Next slide, please. So Laura and Julieta get a warning notice and some emails explaining that their coverage will end if sufficient documents are not submitted. So Laura sends in a copy of her U.S. passport, and that clears the DMI. She's notified, she remains enrolled, all is good with Laura. Julieta is confused about what to send in, so she sends a letter from DHS, and that's not going to be sufficient in our example. So Julieta later gets a data matching expiration notice explaining that her coverage will end because she did not provide documentation to prove her immigration status. Next slide, please. So how Julieta can regain coverage. So Julieta can still regain coverage if she sends in necessary documents, if she provides something different that is relevant to her status as an asylum applicant. After resolve or her because she has her work authorization, there's probably something that she could provide. After resolving the data matching issue, she can re-enroll in the marketplace plan either prospectively, in other words, in the future, or retroactively with a special enrollment period for both in both cases. So we, if Julieta is no longer covered on May 1st, Julieta uploads her work authorization card to healthcare.gov. That clears the data matching issue on May 20th, and then she's eligible for special enrollment period, and she can again decide to either get it, up to, she has 60 days, from the date, or she can have her coverage be retroactive to when she lost the coverage beginning in May. Next slide, please. I'm going to turn it over to Jenny.
Great. Thank you so much, Shelby. So now I'm going to talk a little bit about income verification, because that's another area where we commonly see data matching issues. So as you know, applicants attest to their expected income for the coming year when they apply for coverage during open enrollment. So this year, people will attest to their expected income for 2025. Now remember, going back to our household and income rules, people need to report income for everyone in the tax household. These attestations then are usually matched with IRS tax return data in the federal data hub that Shelby described. And the most recently available data that the federal hub, of course, will be from 2023, because of 2024 right now, people haven't even filed their taxes for 2024. So 2023 is the most recent that they have, which presents some obvious complications since people's household composition and income often change from one year to the next. So the data in the hub is not as fresh as might be ideal. So data matching will work for plenty of applicants, and we'll talk about the risk corridors that sort of allow that to happen in a moment. But as with citizenship and immigration status, there are certain times when the income may not be successfully verified using the federal data hub. So if you're helping somebody with one of the pretty common circumstances here on this slide, then you might be helping them also resolve an income-related data matching issue. So in general, the data matching and consistency rules for income are in place to guard against somebody receiving more of the premium tax credit in advance than they're ultimately eligible for, which is not an outcome many of us want to see. We want people to get their coverage and not to have to pay back later. So this protects them from having to owe a large amount of money back when they reconcile the following year, and it protects the integrity of the program. So if somebody projects a higher amount of income than the information available about their income in the data hub, then this typically doesn't trigger a data matching issue, because it would result in them getting a smaller amount of advanced premium tax credit. And then if their actual income ends up being lower than what they project, it just means they're going to get more money back when they file their taxes the following year. But if somebody projects a lower income than the information available about them in the data hub, then this could result in them getting more premium tax credit in advance than they're ultimately eligible for. But there has to be a pretty big discrepancy between what's in the federal data hub and what the person projects in order to trigger a data matching issue. So for healthcare.gov, and this is optional for state-based marketplaces, the criteria that they use is that the difference between these two amounts has to be more than $12,000 and more than 50% of the income in the data hub. If it meets those criteria, then it will trigger a data matching issue that a person has to resolve by submitting additional documentation. The person will still get the financial help that they qualify for based on their projected lower income, but of course they have to provide documentation to verify that the change has happened or can reasonably be expected to happen as they're thinking ahead to the coming year. And here you'll see a relatively small font size list of acceptable forms of income proof. but there are lots of documents that a person can use to show that their income has gone down. You'll find a full list of the acceptable documents at the link at the bottom of the page for healthcare.gov, but just suffice it to say that there are lots of things that the marketplace will accept when you're trying to verify income. And as we'll talk about, even if you don't have one of these documents, there are options. So healthcare.gov has a helpful guide on how to document income and resolve income DMIs. So highly recommend taking a look at this. It includes worksheets for documenting self-employment income, which can sometimes get a little tricky, as well as a longer list of all the documents that can be used and some examples. But what if a person truly doesn't have documents? They're talking about a change that's going to happen in the future, but it hasn't happened yet, and they have no paper to prove that it's going to happen. Well, in this case, the person can submit a written signed explanation. That's an acceptable form of documentation, and it doesn't have to serve as proof that the other documents aren't available. It just has to explain why their new projection for income is reasonable. So we've got an example here, and we've got Nancy as well as the other people in her household. We've got Nancy's application ID and her state, her contact information, what she projects her income will be for 2025, and a short description, which is that although she's working full-time now, she's going to pick up some coursework next year, and she's going to drop her income amount, and she's estimating that it will go down to $22,000 a year. And that will do it. That will resolve the income DMI. So what happens if the DMI is not resolved? So the marketplace gives people 90 days to resolve an income DMI with an automatic 60-day extension if it remains unresolved after 90 days. And this is true in all states, not just healthcare.gov states. After the end of that 60-day extension, if the DMI remains unresolved, then the person's APTC, their premium tax credit, will be changed or terminated based on whatever income information does exist about them in the federal data hub. The person will remain enrolled in their marketplace plan, but they would be responsible for the cost of premiums minus whatever APTC they're eligible for based on the income in the data hub. So essentially, their premiums are going to go up. Now, if the person has set up an automatic withdrawal to pay their premiums, then the new higher amount could be deducted. So that's something to look for. Or if the person is invoiced for their premiums and doesn't pay, then they could fall into a grace period and risk losing coverage. So, and the details and rules around grace periods can also get a little tricky. So I would refer folks to the link at the top of this slide to familiarize yourself if you need to with those details, because they can get a bit technical. But the good thing to know is that additional extensions are also still available. If the person calls the marketplace call center and demonstrates that they're making a good faith effort to get the required documents, they can get another extension beyond that 60 days. But again, if it's that hard to find what's going on, the simplest route may be to write that up and write a description and just send that to the marketplace instead. So let's go through a quick example here. We've got Neil and Maida. They're married and filing jointly. Maida is pregnant and expects to deliver in February 2025. So their income on their 2023 tax return was $74,000, $39,000 from Maida's job, and $35,000 from Neil's job. So let's also say that Maida does not plan to return to her job in 2025, so she will not have any income that year. When they apply for or update their application for 2025 coverage, they attest to a projected income of $35,000. This is a difference of $39,000 compared to their 2023 income, which is more than $12,000 and more than half of their 2023 income, so it's outside of the allowable thresholds and triggers a DMI. Their income or their eligibility determination notice will note the DMI and tell them how long they have to resolve it, as well as their PTC amount. The marketplace is going to provide them PTCs based on their $35,000 projected income. But if 150 days pass, that's the 90-day period plus the 60-day extension, and they haven't resolved the DMI or requested an additional extension, then the marketplace will revert to using that $74,000 income, their 2023 income, as the basis for determining their APTC. So they won't lose financial help altogether, but the amount they get is going to go down. Now, they can recoup it when they file their 2025 taxes if their income was, in fact, the amount that they were projecting, but that's foregoing a lot of advanced premium tax credits that could have been used toward the cost of their 2025 coverage. So how can they resolve this DMI? Well, as I mentioned, they can submit a statement explaining their sources of income. They don't have to submit additional documentation in this case, since the change is due to the lack of an income source. Now, if they were instead documenting a decline in income, like fewer hours on the job, or a change in job, they could also upload copies of documentation to show that, such as pay stubs. Now, in this particular example, also just a reminder that they will want to report the household size change to the marketplace as soon as MEDA delivers. This is to ensure that the baby is enrolled in coverage, which would be Medicaid given their income, and to update their household size. With more people in the household, Neil and MEDA will qualify for a higher tax credit. And in the event that MEDA delivers multiples, Neil and MEDA may themselves be eligible for Medicaid, depending on whether the state they live in has expanded. So we got some questions about this in the Q&A already, but a person can actually resolve their DMI and restore lost advanced premium tax credits by submitting documentation, submitting an explanation, or even going into their application and correcting their income projection to align with the data in the hub if they realize that their initial projection wasn't right. Now, even if the 90 days plus the 60-day extension has expired, which means their APTCs have likely gone down or gone away, if they submit documentation, they can restore them. They can also file an appeal to the DMI decision, and if they're successful, they can get premium tax credits retroactively. If they're unsuccessful, they can still get PTCs back for the gap months when they file their tax return, assuming it corroborates their new lower income. But the issue there is that if they are losing financial assistance, it may be hard for them to keep coverage, and they can't collect PTCs at tax time for months that they weren't enrolled in marketplace coverage. So one more example here, we have Connor and Lily, who are married filing jointly, and they attest to an annual projected income of $40,000 for 2025. But their income on their 2023 tax return was $85,000, which triggers a DMI. They enroll in a silver CSR cost sharing reduction plan with advanced premium tax credits and are required to acknowledge when they do that they are taking advanced premium tax credits during an inconsistency period, and those payments are subject to reconciliation when they file federal income tax returns. So they enroll in a silver CSR plan with APTCs, but there's a lot going on in their life. They're in the middle of a move, their address doesn't get changed. Long story short, they don't get the notices and they fail to resolve the DMI in the required window. So as a result, at the end of the 150-day period, their APTCs are reduced, and pretty significantly in this case, because we're going from 196% of FPL to 416% of FPL. And as a result, they also lose their CSRs. They're going to receive a notice in the mail about this if they're receiving notices, or if they're receiving mail rather, but if they haven't updated their information, they may find out about this the hard way when they're trying to get services. The good news is there are some options even for people in this case. They can go ahead and submit the documents to verify their income now, which would restore their full APTC and CSRs. Can also appeal if they lost coverage, for example, because they stopped paying the higher premiums that they're charged now because their APTC is lower, then they would need to appeal to regain coverage. Unlike citizenship and immigration, there's no special enrollment period if they lose coverage due to a drop in advanced premium tax credits. The good news is the appeal is pretty straightforward, and if they submit the information needed to resolve the DMI and their appeal is successful, then they can get full APTCs and CSRs restored retroactively or prospectively, whichever they prefer. Then the third option is they could just stay enrolled in their current plan, pay the full premium and the higher cost sharing amounts, and they'll still be able to claim the premium tax credit that they're eligible for when they file their 2025 taxes in 2026. But they can't get money back for the cost sharing reductions. So any services that they paid for, they're paying at a higher rate than they would have to pay if they were enrolled in a CSR plan. And if they lose coverage because they failed to pay their premium, then they'd have to wait until the next open enrollment period to get coverage again. Okay, just a few more things. Your verification of other minimum essential coverage. So there's another kind of DMI, which is less common, but it's when there's an electronic match with the state Medicaid agency, with Medicare, or with the Office of Personnel Management for federal government employees. And it shows that someone who's applying for marketplace coverage is enrolled in or eligible for another form of minimum essential coverage. And if a person gets this kind of DMI, They can enroll in coverage with an APTC based on their attestation, but they will need to submit documents to prove that they're not eligible for or enrolled in any of these other forms of coverage. They can submit a letter from an insurer with a termination date or a termination notice, or even a denial notice from a Medicaid or CHIP agency. But if this DMI is not resolved in 90 days, then the person will lose APTCs. They don't get a 60-day extension for this kind of DMI. And then we have periodic data matching notices because we like acronyms and we need lots of them in our lives. So there's a periodic data matching notice is when the marketplace checks to see during the year if people are enrolled in Medicaid, CHIP, or Medicare. And if somebody's found to be enrolled in one of these programs and they're getting APTCs, then they'll get a notice from the marketplace that gives them only 30 days to resolve the issue before the APTCs are terminated. So people need to act very quickly when they get a periodic data matching notice. For Medicaid or CHIP, if the person is actually enrolled, then the notice asks them to end their marketplace coverage. If they're not enrolled, then they need to update their marketplace application. And if they don't act on the PDM notice, they'll lose their APTCs and they'll be billed for their full marketplace premium until they cancel their enrollment. For Medicare, the marketplace will terminate the APTC, but leave the marketplace plan in effect at full cost. Or if the person has chosen when they applied originally for marketplace coverage to have that coverage end automatically when they become Medicare eligible, then the household's enrollment in the marketplace plan will be terminated altogether. And any other family members who may still be eligible for the marketplace will have a special enrollment period to re-enroll in coverage without that other family member. With that, I'm going to turn it back to Shelby to bring us home on identity proofing.
Thanks, Jenny. Next slide, please. So one of the first things that's kind of important to note about identity proofing is that it's not an eligibility requirement. Now, I get that that is confusing, right? Because it's kind of one of the first things that happen when you go and log on to healthcare.gov. What happens is that an individual is going to be asked some information about one person in the household, generally, one of the two either the taxpayer for the household or one of the two joint tax payers. They're going to be asked to provide a bunch of information, and in general what the computer is trying to do is to electronically prove that this is the person that they are. This is something that we oftentimes run into in lots of different parts of our lives, right? We're setting up an account for a bank, online, where doing all sorts of things. There's generally some type of process where the entity that we're trying to create an account in is trying to make sure that we are who we say we are. So that's what's happening in identity proofing. It's not an eligibility requirement, but it sure does look and act like it for some people. And when you can't complete the task online, it means that the individual will not be able to submit the application online. They won't be able to select the plan online. They won't be able to report changes online. They won't be able to cancel enrollment until they are able to get their account past the identity proofing process. So there's a lot of good reason to get through the application process, but there are some individuals who just simply the way that it's designed today is that it's very reliant on checking information against records and credit history, based off of credit history. And there's a variety of reasons why some individuals just don't have a credit history. And when you, in particular, are working with people who are maybe newer immigrants, new to the US, they're very unlikely to have that, be able to meet that part. Next slide, please. So, what is the process? So first, like I mentioned, you have healthcare.gov trying to do the identity proofing online, right? With the questions that are asked that are generated based off of somebody's credit history. If people can't get through that first electronic process, there's what's called telephonic identity proofing. So some people are going to be asked to call Experian to complete the identity proofing over the telephone. And in that case, if they successfully are able to answer some questions that Experian has, they would then be provided a unique reference code, and then they can go back online and put that code in, and then they can get their identity proof that way. The third way that you can prove identity is that the consumer who can't complete the identity proofing online or over the phone, they can submit copies of certain documents to prove their identity. And just to be clear, there are some people who won't even get sent to the telephonic part. They'll just immediately be asked, hey, can you submit one of these documents? So in the meantime, like again, some individuals may not have documents to provide this to provide at to overcome this identity proofing hiccup, and it takes time, right? It's not going to instantaneously clear. So what they can do is they can continue with the application via the telephone by calling the healthcare.gov's marketplace, and then they can submit the application over the telephone. Next slide, please. So here's just a list of all the different documents that can be used to be uploaded to overcome this data matching issue. I'm just going to note that, there might be some individuals who simply don't have any of these things. So that will be a challenge. And again, while it's not the best, it is still an option to go ahead and move forward without delay by submitting an application over the telephone. Next slide, please. So people unable to complete identity proofing, as we mentioned, this is what I talked a little bit about, but here you can see kind of the upload, documents option. And there are going to be some people that are going to be given that option immediately. And then there are others who might be able to call Experian first. But again, what an individual can be doing while they're uploading documents and while that processes, or even if they can't upload the documents, is that they can go ahead and complete as much as they can in the application, which oftentimes includes information about individuals in the household and even their income information. And then they can call the ACA marketplace, and then they can, the marketplace can pick up where the person left off, ask additional information as needed, and then the call center can finish the application, submit it over the telephone. So after the call center kind of pushes through that application, you can log back on and complete the enrollment process so that you can utilize some of the pieces to be able to help you in terms of figuring out what plan you want. Next slide, please. Oh, Q&A.
Yes, time for Q&A. Thank you, Shelby and Jenny. So we're going to get into a couple of questions. I know we have a limited amount of time, so we'll just see what we can cover. So first question is, if a lawfully present individual with income less than 100% of the federal poverty line gets sent to their state Medicaid department by mistake, will they still be able to enroll in the marketplace pending their DMI?
Thanks. So that is a really good question. Yay to the person who asked it. It's one of it's an ongoing frustration in the marketplace that if you think about what's happening when you go through the application, right? You're attesting to your immigration status, and then the computer, if it's not able to do a data match based off of the information you provided, it's unsuccessful and you have a DMI, the computer is going to assume that, because computers make assumptions, they only work with like yes or no's kind of situation, right? The computer is going to assume that you've attested to having an eligible immigration status for any of the healthcare programs that you're applying for on the application. So the computer sees that your income is below the poverty line. In this case, it could even be under 138% of the poverty line. and it says, oh, wow, this person is eligible. Let's say that you're working in Virginia or Illinois. The computer is gonna say, this is a person who's fully eligible, but we need more information to prove their immigration status. And their income would put them at the Medicaid limit. So what we're gonna do is we're gonna send them and we're gonna assume this person's eligible for Medicaid. And that is no fun, because what ends up happening is that, the truth is that this is an individual, let's say, that is lawfully present, but is ineligible for Medicaid based off of their immigration status. That's the problem, right? Because if they were truly eligible for Medicaid based off of their immigration status, they went to the right place, right? Then we don't have a problem. But I'm assuming that the question is really indicates that the individual is lawfully present but ineligible for Medicaid based off their immigration status, which is a lot of people. That is no fun. The person would be sent to Medicaid, would have to be denied from Medicaid, and then find their route back to the marketplace, indicate that they're ineligible, that they were found ineligible based off their immigration status. Now, there are a lot of people who have gone through that process before. Medicaid's already made an eligibility determination that they're ineligible for Medicaid, and the person knows it. They've gotten a notice before. The way that the application is designed, and I'm talking about the healthcare.gov application, there is a question that the consumer can answer if they have actually been found to be ineligible for Medicaid based on their immigration status for the last about 5 years. They can indicate that, and then they would be able to go ahead and proceed, and the computer would know to treat them as there's somebody that is ineligible for Medicaid based off their immigration status and needs to resolve that data matching issue, but then would be able to continue in the application during the time that they need to resolve the application issue. I know that was a confusing answer. What I would recommend is anybody that falls into that situation, go back and listen to our presentation that we did on eligibility based off of immigration status, where we kind of walk through what's going on behind the scenes on that.
Thank you, Shelby. So we are at time, so we're gonna have to move on, but please feel free to reach out to us at Beyond the Basics, or at our Beyond the Basics email for further questions. Here are the resources presented during today's session. And next week we have 2 webinars, Tuesday and Thursday, but we are starting with the What's New for 2025 webinar on Tuesday, October 8th at 2 p.m. Eastern Time. You can register for this and upcoming webinars on the Beyond the Basics website. And of course, you can reach out to Shelby, Jenny, and the general Beyond the Basics inbox for any clarification questions or things that you just we didn't get to cover during our Q&A session today. So with that, I will bring this webinar to a close and thank you all for joining.